Thank you very much, and thank you, Mr. Chairman. And you know, as a veteran, I do know and I appreciate that the VA system is trying to do its best in difficult environments within budgetary constraints and personnel constraints, etc. But I want to ask specifically, since one of the issues that came up since the hearing is on prescription narcotic overuse, perhaps, in the VA system. And, you know, one of the findings, that was at the Jackson investigation back earlier in this year, was this issue of, you know, advanced practice nurses, supervision of advanced practice nurses, whether it was adequate. There were all kinds of, and you've read the report, you know what I'm talking about there. And now, you know, one issue that's come up is this nursing handbook issue, where instead of the VA kind of following along what Dr. Bohorik's recommendations are, which actually, you know, an attempt to provide better treatment for our veterans, including those in the pain management system, is, you know, one of the recommendations, reverse the trend to replace physicians with cheaper extended care providers. But nursing handbook change, which would encourage all advanced practice nurses to become licensed independent providers. For instance, let's say you had an advanced practice nurse who was named the pain specialist or medicine, whatever the title is at the VA, but that person felt uncomfortable doing that. They felt uncomfortable in independent practice. They actually thought that it was appropriate to be collaborating or supervised by a specialist physician. The nursing handbook says they have to go work somewhere else. You either achieve independent practice or you go work somewhere else. This is strange because in a environment like pain management, or in the environment of on a care team, like in my specialty, anesthesiology, you know, the culture usually is that there is a culture of it's multidisciplinary, it's collaborative, and with recognition that there are different level of providers with different levels of expertise. It seems to be going exactly the opposite way with that thing. So I'm going to ask you, Dr. Jesse, do you feel, given that this is under serious consideration, I know that the ranking member and chair have letters to you addressing concerns in the AMVETS and other groups, do you feel that the training is equivalent, or the ability to treat patients is equivalent for the APRNs achieving licensed independent practice and medical specialists? So, a simple question. Do you roughly make?
Oh no, I don't equate them. No, but I want to be clear about something. The nursing handbook was a draft. It's not been approved.
So what I'm getting to is, what is your opinion on it, since you are going to be one of the decision makers, I understand.
So I'm a cardiologist. I don't believe that a nurse practitioner, I have very good nurse practitioners and PAs that work with us in cardiology, but we work as a team. And just correct. As you work with the nurse anesthetist as a team.
Independent practice assumes not working as a team. That's why it's called independent practice. And in fact, under statute in states that establish independent practice, it specifically says, and I can quote from the statutes, that they work without involvement, requiring no physician involvement. That's what independent practice means in state statutes. No physician involvement. In the pain management program in the VA system, do you think that would be an improvement?
No, not necessarily.
Okay, not necessarily, but under what circumstances would that be an improvement?
So if we had a VA facility that did not have inpatient surgery, outpatient surgery, but there were the need for some level of skills that a nurse anesthetist could bring, that would be useful to veterans so that they wouldn't have to travel. Now, in our system,
I asked about pain management, not anesthesia. Specifically asked about pain management.
But in those situations, whatever the nurse anesthetist could bring to that, it would be useful to veterans. But they would still be working within the construct of a team, even if that team were connected to one of the major medical centers. So again, this handbook that you've seen is a very early draft. It is not agreed upon by the system. We will not move anything forward until we've had robust discussions with external stakeholders, including the societies. I know ASA is very interested in this. I know the family practice folks are very interested. AMA is very interested, and I can tell you that this will not move forward till we have had those discussions with all of the stakeholders.
Sure, and I appreciate that. And specifically with regards to pain management, you understand the complexity of the DEA regulations.
Oh, absolutely.
And supervision requirement
Yes, I do.
Because, of course, you don't have the ability of preemption with DEA law. Thank you very much, Dr. Jesse, and thank you very much for holding the hearing. And I want to thank the committee for allowing me to participate.